people behind them. KC Cares is the intersection of the nonprofit and profit communities, making Kansas City a better place to live, work, and play. This KC Cares segment is brought to you by the Ewing Marion Kaufman Foundation, www.kaufman.org. I'm Ruth Baum-Biggis. There is one word that begins with a C that most of us dread to hear from any healthcare provider: cancer. Incredible strides have been made in the medical field to battle the C word, providing treatments and increasing survival rates. And Kansas City is at the apex of the best treatments and research happening today through the University of Kansas Cancer Center, a nonprofit organization. Dr. Roy Jensen, a native of Kansas City, Kansas, came to the center in 2004 and led it to the highest designation in the world of cancer treatment, a National Cancer Institute, one of only 70 such centers in the United States. Dr. Jensen has received numerous honors in both the medical world and civic arena, most recently being named Johnson County of the Year. So how does this accomplished gentleman manage this huge medical facility and its team? Well, joining us today to find out is Dr. Jensen himself. Welcome. We're so happy to have you.
Well, thank you for having me on the program. It's a real pleasure.
All right, we're going to give you that 30-second commercial opportunity to share with our audience. University of Kansas Cancer Center. What is it and what do you all do?
Well, the University of Kansas Cancer Center is responsible for really all of the research, clinical, and population health activities as it relates to cancer, not only within the confines of the university, but also across our two consortium partners, Children's Mercy and the Stowers Institute for Medical Research. And so these institutions have all come together to really provide what we think is our, putting this region's best foot forward to fight cancer in this region.
How many folks are you responsible for in this huge effort to really, knock down cancer?
Well, the most important number that we're responsible for are the unique patients that come and utilize our facility every year. And right now, that's around 55,000 people. Either come here for cancer care, for survivorship services, for prevention or screening activities. So it's a pretty broad range of different endeavors, but all of them are focused on mitigating the effects of cancer in our community and trying to diminish the number of diagnoses of cancer and the number of people that unfortunately die of this disease.
So you're all over. You're doing diagnoses, you're doing treatment, you're doing, to put it out there, people who may have no other possibilities of treatment other than to come to a research facility that's doing cutting edge.
Absolutely. So, a big part of that is when we take care of patients, offering them the opportunity to go on cutting edge clinical trials. And, that's been responsible for most of the progress that we've made over the last few decades against this disease. When you look at data from back in the 1970s, when the Cancer Center concept was first created, the 5-year survival for all cancers combined was about 49%. And now it's just under 70%. So we've made a lot of progress, and most of that progress is due to new discoveries that are then turned into clinical trials that tested against standard therapy. And if we find out that we've developed something better, then that becomes the new standard of care.
That's an amazing jump. I don't know if people can really appreciate that unless cancer touches your life. And I think so many people are touched by it, if not by themselves, by someone they know and love. I have a stream within my own family. So when someone comes to the center, how do you wrap people in? How does that happen? That they come to you versus, some other hospital, some other location at another cancer center?
So that's a great question, and we have an entire group of folks that are patient navigators. Most of them are come from with a nursing background, and what those people endeavor to do is to make sure that cancer patients get plugged into the system, that they see the right kind of doctor. They ensure that their medical records, their scans, and things like that are transferred over to us, and get them in front of our multidisciplinary teams of caregivers that can focus on their specific type of cancer. And so I think that's one of our real strengths is that we have well over 150 clinicians that take care of cancer patients, and they have the luxury of being able to specialize in different types of cancer. So our breast cancer clinicians just take care of patients diagnosed with breast cancer, and likewise, our leukemia physicians just take care of folks that are diagnosed with leukemia. That allows them to be really on the cutting edge of what is the standard of care, what are the clinical trials that are being offered to specific types of cancer patients, and to work across all of our disciplines to ensure that we're moving the ball forward as far as developing new types of therapeutic approaches.
Are there particular cancers that KU Center is more focused on, or you're known as the experts in, as opposed to the other 69 centers, perhaps?
So that's a great question. By far and away, the largest number of specific type of breast or cancer that we see is breast cancer. And we see somewhere between 1,200 to 1,300 newly diagnosed breast cancer cases each and every year. That is by far the biggest number. And we have had a significant presence in breast cancer treatment and prevention for many decades now, as a result of the efforts of Carol Fabian and a number of other folks in our breast cancer group, and that's also our largest research program. When you tally up all the different grants that we have, quite a few of those of our investigators are focused on breast cancer. But we also have several other areas of expertise, including hematologic malignancies. That, of course, includes acute leukemia, lymphoma, multiple myeloma, Hodgkin's disease. That's another very large group. And we have quite a large number of clinicians that focus on gastrointestinal types of cancer. So colon cancer, stomach cancer, pancreatic cancer, all of those are quite common, and we have a large group of clinicians that focus on that.
As I mentioned at the beginning of our show, there are 70 centers. You are one of those. Is there collaboration with the centers? Is that a true network?
So actually, so there are 70 other centers besides us right now.
Okay,
So
thanks for the correction. I
right now,
appreciate
there's
it.
a total of 71. And there is a rumor out there that they're about to add another one. So it looks like the University of Florida is about to get designated, is my understanding. So there soon there will be 72 centers. And in answer to your question, yes, we collaborate all of the time. In fact, last night I just got back from the American Association for Cancer Research annual meeting that was being held in Orlando. And pretty much all of the major cancer centers were there. I probably had a minimum of 2 to 3 meetings with my peers at all those cancer centers every day at that meeting. And we discussed a wide range of issues, and also attended talks on some of the the latest findings in cancer research across the entire spectrum of different disciplines.
I want to get back to, again, the beginning of our program, and I made a point of saying you're a nonprofit organization and you're a medical organization. So how does that work? I don't know that nonprofit always comes top of mind to the general public when they think of healthcare. So how does that differentiate you, let's say, from the other health entities out there?
Well, for-profit medicine is an interesting, concept in that a shareholder who ultimately, of course, is in charge of the operation becomes an important factor in how those types of healthcare organizations are set up. And obviously their primary concern is profit. And while we have to make sure that we're not, losing money, designing our healthcare system and, who we hire and what we focus on is not, profit is not what it's really all about. We're trying to provide cancer care across the entire spectrum of different cancers. And also, we have a mission of educating the next, the future cancer professionals, whether they be physicians, nurses, researchers, or pharmacists, or what have you. And of course, we're also interested in doing research to move the field forward and develop new types of therapeutic approaches. And that is, by and large, not something that the for-profit medical care is really focused on. They're much more focused on delivering care in a way that certainly I think they try to do a good job taking care of their patients, but in the back of their mind, they always have to be taking care of their shareholders as well.
The dollar bill, as it were.
Yes,
We're talking with Dr. Roy Jensen. He is Vice Chancellor and Director of the University of Kansas Cancer Center. How do you manage such a large nonprofit organization? That's got to be daunting in and of itself. Everybody pulling at you. How do you do it?
Well, I think the most important thing is hiring a lot of good people and getting out of their way is the path to success that I've determined. I see very little reason to hire somebody who I think is smarter than me, who knows more than I do about a certain subject, and then try to micromanage them and tell them what to do. My role, I think, is primarily one in which I try to identify talent and expertise in particular areas, and then bring those people together so that the right hand knows what the left hand is doing. But I certainly don't try to dictate, how someone delivers care, how someone does research, how someone specifically organizes our educational programs. I think it's much better if you hire somebody who knows how to do those things, and then provide them with a vision for how you want the overall operation to work. But at the end of the day, my role is to identify talent, provide them with adequate resources, and get the heck out of the way.
What are the greatest challenges that you face today as the leader of the center?
I think that one challenge is that, and it's also an opportunity, is that there's never been a more exciting time in cancer research and cancer clinical care than right now. I have been, at this for close to 40 years now. And frankly, the amount of progress that has been made in the last 5 to 10 years is truly astounding. We're taking patients, say with stage 4 lung cancer, stage 4 metastatic melanoma and kidney cancer, and acute leukemia, which had exhausted all known therapeutic approaches. And we are saving those patients and greatly extending their lives due to new therapeutic approaches that are coming on board. And whether that's specific forms of immunotherapy like checkpoint inhibitors, or CAR T therapy, where we take patients' own cells, engineer them, and then give them back and essentially teach those cells how to kill that patient's cancer. And those things, it's almost like a Star Wars or Star Trek kind of level of a wow factor there, what we can do these days. And so that's incredibly exciting. And we are making significant progress against a number of different cancers. What's, still frustrating, I would say, is that there are a number of different types of cancer, like brain cancer and pancreatic cancer and a couple of others, which have proven to be really tough in terms of developing new therapeutic approaches. But I'm sure that as we move forward, we'll make discoveries that make that different. So I would say that the biggest challenge right now is those cancers that are proving to be tough nuts to crack.
Why this supersonic progress, do you think, in knocking down some of these cancers or making them more treatable? What is it?
I think a lot of it has to do with research that got started back in the 80s and the 90s and the early 2000s around our fundamental understanding of how the immune system works. And, for quite some time, we had observed, patients with melanoma that had widespread disease that appeared to undergo almost kind of a spontaneous, remission of their cancer. And what became apparent is that the patient's own immune system had figured out how to attack their own cancer and to cure themselves in essence. And in those situations, it was the immune system that was responsible for making that happen. And the research that went on starting in the 80s was figuring out, what are the mechanisms that the immune system is utilizing to achieve those seemingly miraculous cures, and then how can we then develop new therapeutic approaches based on that knowledge. And those started coming on board about 10 years ago. And we've been making incredible progress ever since then.
As the leader of the center and all these folks that are doing amazing work, is there anything that keeps you up at night leading such a dedicated team and 55,000 patients, et cetera?
I would say trying to make sure that we're able to meet the demand that's coming our way over the next few years, and by 2030 or so, the expectation is that we will have somewhere between 40 to 50% increased number of cancer cases due to the aging demographics of our population. And so the entire United States is about to become like Florida, where 1/4 of the population is 65 years of age and older. And in fact, a week from today, I'm going to be joining that group. And so obviously this is something that I'm interested in. But if you look at cancer patients, well over half of them are diagnosed at age 65 and over. And
wow,
when you have a population that is enriched for those folks, which it's great that people are living longer, but it also means that you're going to start seeing a lot more cancer cases in your population, and that's what's happening. And so we need to make sure that we have the facilities to handle these people. We have the personnel across all the different disciplines to handle these folks, and frankly the resources. And it's not going to be just about treatment and diagnosis. It's also going to be about prevention. And so getting people to stop smoking, getting people to lose weight, getting people to have the right vaccines to be able to prevent cancer. All of those things are going to be critical factors in making sure that we're able to meet this oncoming public health challenge.
We just have a few minutes left, and I wanted the audience to know a little bit about Roy Jensen. Why was this such a passion for you? Always interested in medicine and in cracking open science?
I guess the answer to that is no, because when I graduated from high school, I announced that I had no idea what I wanted to do, with the exception of the fact that I did not want to be a physician. And that was influenced in part by my mother being a nurse and working for a family physician in Overland Park, who I thought had the worst lifestyle of anybody I'd ever seen in my life. And the guy just worked like a dog, pretty much round the clock. And I didn't want any part of that. But when I got to college, I took a bunch of science classes because that's what I liked. And there were a whole bunch of pre-meds in those classes. And I got kind of turned on to science, and also became aware that there were many, many different career paths for someone going into medicine, and it didn't, and so that's what got me interested.
And so pathology was your specialty.
Right.
Can you quickly tell us then how you got roped into leading this world-class institution back in your own backyard?
Sure. So I went. I'm from Kansas City, as you pointed out, but I went to Vanderbilt for medical school, and a lot of my mentors and teachers at Vanderbilt were pathologists, and specifically focused in breast pathology, which I'm a breast pathologist. And at Vanderbilt, the director of the Cancer Center, in fact, the founding director of the Cancer Center, was also a pathologist. So for me, it just kind of, that's just standard operating procedure. I've obviously come to find out that that's fairly unusual, but I think it's a great platform to be a Cancer Center director because you interact with pretty much all the clinicians. You get to see cancer patients and different types of clinicians that focus in the various areas, and you have to establish a great working relationship with all of these people because you're a critical part of the healthcare team. And obviously getting the diagnosis right is the first step towards being able to do what needs to be done.
Well, we're very grateful that this kid from Kansas City who never was going to be a doctor is now a doctor leading this world-class Cancer Institute. Where is the best place for people to find out about the work of the Cancer Institute, or if they would be a patient that qualifies, or to find out for a family member? Your website?
So we have a website, kucancercenter.org, and that covers both the clinical side and the research side. We also have a KU Cancer Center app, both on the Mac OS and the Android side, that lists all of our clinical trials that are available. And we have a version for not only for clinicians, but also for patients. And so that's a great way to get plugged in there. And, we're happy to try to meet your needs, whatever they are.
We would expect nothing less from a cutting edge center than to have all the apps and the technology to reach you and for people to communicate and stay on top of things. Dr. Jensen, thank you so much for your time. I know how very busy you are, but we sure appreciate and have loved chatting with you and sharing about this wonderful health institution that's in our community.
Well, thank you, Ruth. It was a pleasure to be on your program, and I enjoyed talking with you and your audience.
Thank you for joining us for KC Cares, Kansas City's nonprofit voice. We're produced by Charitable Communications, also a nonprofit. This KC Cares segment was brought to you by the Ewing Marion Kaufman Foundation, www.kaufman.org. If you'd like to be a guest on KC Cares like Dr. Jensen, or underwriting opportunities, please visit our website, which is kccaresonline.org. And spread the love. You'll find us on Facebook and Twitter at KC Cares Radio, and on Instagram at KC Cares Online. Don't forget, you can catch us Saturday mornings on ESPN 1510 AM and 94.5 FM at 8 a.m. Thank you for joining us on KC Cares.